and I'm the Senior Vice President for Institutional Development for Hispanic Federation. And I'm excited to kick off this session focusing on fighting poverty and building resiliency within Latino communities. I'm joined by nonprofit leaders and panelists Ramon Peguero, President and CEO of Hispanic Children and Families of New York City, Karina Ayala Bermejo, the CEO and President of the Instituto del Progreso Latino in Chicago, and Brian Rosa Rodriguez, the Public Policy Manager for Youth Development Institute of Puerto Rico. Welcome so much, and thank you for joining our panel today. But before we start this conversation, we'd like to share some brief prefatory remarks offered by the chair of the Congressional Hispanic Caucus, U.S. Representative Dr. Raul Ruiz.
Thank you, Brett. Good evening, everyone. My name is Congressman Dr. Raul Ruiz, and I represent the Coachella education, health, immigration, civic engagement, economic development, the environment, and much more. Together, we can advance public.
Thank you so much, Chairman Ruiz. We're so delighted to have you leading the way for our community in the Congressional Hispanic Caucus and in the Congress. And we know that your efforts have been a big part of why the current bill has been such a big benefit to Latino communities across the country. So I want to follow Frankie's lead and suggest to everyone that let's just pretend we're in a living room sitting together and talking amongst each other. And I would like each of our panelists to introduce themselves briefly, but also to start by answering one of the key questions I think facing us during this whole summit today, which is how have your organizations been able to respond to COVID-19 and serving our community? We know that your Latino organizations are the trusted voices in our community, that you're the folks that our community goes to first when they need help and support. And so we know that you've had a lot of demands placed upon you. So just tell us a little bit about how you've been able to respond. And then on top of that, if you could perhaps mention, if you had additional resources, what else would you be able to do? What other things would you like to be able to do to better serve our community? Ramon, you want to go ahead and start?
Thank you, Brent. Thank you so much. First, let me start by thanking the Hispanic Federation, Frankie Miranda, his president, and the entire team for putting this much-needed summit together. You know, when flying on the plane, you will hear them instruct you to first put on your oxygen mask in case of an emergency, and then assist others. Well, this pandemic didn't only affect the families we serve, it also had a huge impact on the organizations that help those families in our community. We at CHCF knew that we needed to help. But the question was, are we equipped to do so? And to that end, we did a quick evaluation of our resources, our abilities to ensure that we had what was needed by our community. We then set out to support our community with some new basics. Through our work with the state and the Office for Children and Family Services, we were able to secure hand sanitizers, masks, and other PPEs for our providers of early learning educational services in residential settings. Some call them at-home childcare providers, but I think that that title minimizes the quality and the importance of their work and their profession. We also, working with the through the CARES Act, we've been able to ensure that essential worker parents receive scholarships to pay for childcare while they put their lives on the line to keep the economy going. Furthermore, money was also made available to providers to retrofit their homes in line with the CDC guidelines, allowing them to continue to educate in their home and keeping those essential services open to our community. Last I checked, we, along with our consortium partners, have been able to disperse over $7 million for these endeavors. In our after-school programs, we had to pivot to a vital model. This meant that we had to assess our students' ability to receive virtual instructions. We were able to provide hotspots to 120 of our students whose housing conditions did not allow them to have internet access that they needed to go remote. We also purchased 32 laptops and lent them out to our students to ensure that the continuity of their learning experience. These were students that were not given the tools that they needed to continue their education, nor did their families have the financial resources to provide them for them. Additionally, we provided hundreds of backpacks to our students filled with books and PPE as they began their transition back to a hybrid model of learning. Furthermore, we are happy to report that during these most difficult of times, we were able to encourage 9,000 families in our community to fill out the census. The pandemic will soon pass, God willing, but the effects of our communities being undercounted in the census will have a long and enduring negative consequence. The food insecurity that we are going through, we have been able to partner with local elected officials, and presently we give 200 meals to families weekly, a meal that serves for a four-person family. We have continued to do the advocacy and the policy work, because a lot of times in times of emergency, people forget that the issues that our families and our communities are going through sometimes are put in the back burner. So our policy and advocacy team are ensuring that the voice of those less fortunate, those that sometimes get muffled in the crowd of many, are listened to and are heard. I am very happy about the American Relief Act and the monies that it has been put in there for our community. I am hopeful that as it trickles down, our community, our people, our families will receive their fair share. We talk about essential. Well, essential equates to how vital you are. Our community has said presente, and it is time that we are treated as the essential, not only workers, the essential Americans, the essential humans that we are in this economy. Thank you, Brett.
Thanks, Ramon, and thank you so much for the work that you're doing. And yes, we'll work closely with you to make sure that you are getting the essential support that your organization and so many others deserve. Brian, do you want to go next?
Sure. Thank you, Brent. And Ramon, amazing work. Thank you for sharing all that you do. I'm the policy manager for the Youth Development Institute. We're a data research and advocacy organization. And back at the beginning of 2020, we all woke up with earthquakes on the island, and that really rattled and shifted the way that we would really think through our process and our analysis. So thinking about that natural disaster just 2 months after a worldwide pandemic launched, none of that was in our strategic plan. I bet nobody was planning on having a pandemic for 2020. So as a research and data organization, we quickly went to our strengths. We basically developed an economic estimate of the impact that the pandemic might have had on families with children in Puerto Rico. So this allowed us to really understand and pull up policy recommendations of things that policymakers could do immediately to really start pushing the needle on equity for Puerto Rican families. One of the things that we discovered is that Puerto Rico was left out of a huge nutritional package called the Pandemic EBT program. This program allowed children who went to school to receive the money equivalent to that meal that they would get for lunch and breakfast directly to their card that a family would be able to use. We didn't get access to that program up until September, and it took a lot of advocacy and a lot of coalition work. So we really put it up in our agenda, and we really pushed for that throughout 2020. And we also, it wasn't until last month, February, that the funding was retroactively given to families with children in Puerto Rico. So the fight for equity is something that we are really always pushing for. The American Rescue Plan really starts engaging those policy items that we have in our agenda, including the child tax credit and the earned income tax credit for Puerto Rico. However, we understand that these are components of our larger plan. Child poverty rates in Puerto Rico have not changed since early 2000s. This is a problem and a crisis that although we've grown used to, it's a problem that we shouldn't have. As American citizens in Puerto Rico, we deserve the same dignity and the same respect as everyone else in the whole nation. So we're really proud that this administration has set forward a nice precedent to start and really put forward equity issues around Puerto Rico. However, we understand that might not be enough. And I know we're going to get the chance to talk more about that later on. So I'm going to leave it at that.
Thank you, Brian. We definitely feel for the people of Puerto Rico who have been through so much, whether it's the debt crisis, Hurricane Maria, the earthquakes, and now the pandemic. You've been asked to bear more than any people should be asked to bear. And so whatever we can do to support your efforts are certainly very important to the Hispanic Federation. Karina, can I ask you to finish up for us?
Absolutely. Such a pleasure. Thank you, Brent. Thank you, Ramon. Byron, I celebrate, right? Long overdue, focused effort on Puerto Rico. You and your efforts are critically important. And Ramon, thanks for sharing. I'm the president and CEO of Instituto del Progreso Latino here in Chicago. Immediately when the pandemic hit, we knew we had to pivot in the most major way we've ever had. While crisis is not new to our community, this was something that we really needed to give a triple down on. Work with the census was already in motion. Work with creating digital illiteracy programs was already in motion, but we have to accelerate everything. Instituto de Progreso Latino believes that every immigrant and their families can reach their full potential through education, training, and employment. So we are deeply rooted in education. And imagine the horror when we realized our 2 high schools needed to go remote. We launched a college for the very purpose of addressing health inequity so that we can offer a pathway into nursing, a pathway into becoming a nurse. And now we have to go remote. So immediately we surveyed our participants and we wanted to respond to their needs. Shared with us was that 60% had a drop in income, right? 30% lost their jobs and 30% were reporting mental health illness already. And that was at the onset of the pandemic. At the onset of the pandemic, our family's income was about $19,000, right? So just imagine taking a dip in an already burdened economic situation in our community. So we responded very similarly like you did. Around technology, we ensured that the Wi-Fi was available. We had already started at Instituto creating a hotspot in our parking lots so that our students can come in, pick it up, and get on with their education. We knew we had to put 400 computers in our students' hands, and we did that. We're working on now becoming a one-to-one loaner system. And for our second chance opportunity school, our school where students who've dropped out, traditional education didn't work out for them, and we have about 110, we knew that in order to incentivize our students to come back, we have to be innovative, right? So the curriculum, the student-centered curriculum in that space is phenomenal. From midnight tutoring to tutorials to really accelerate education, keep students engaged was a priority, especially for those students who traditional ed had not worked out for them. And we continue with our partnership, our really proud partnership with the Hispanic Federation to ensure that digital literacy isn't just for now, isn't just to learn how to use Zoom, but to transform, to use this opportunity as a way to transform the way we use digital learning and to really be an expert so that coming out of the pandemic, our students, our families are in a position to succeed when it comes to digital literacy. And just so you have a perspective, since July, we have trained 156 individuals on digital literacy. Now that they are solidly strong and able to use technology in a way that will render better workforce outcomes. So thank you, Brent. Thank you, Hispanic Federation. Thank you, Frankie, for that partnership. We're really proud of it. Number 2, food insecurity was also a red flag for us. We immediately pivoted. We've never done food distribution before, but we became a central critical anchor of food in our community. We've fed over 55,000 individuals. We do daily lunches, and it's sad to see that need has not gone away. We get upwards 2,000 individuals in a line. What it does do, it allows us the opportunity to have an access point with our community, to push out other resources, to remind them that we're here beyond the food, beyond the pandemic, to get back into work. So because workforce development is so critical and because so many of our participants lost jobs, we were able to engage and have our employment specialists work one-on-one with individuals who rely on Instituto. And the third is the housing. To your point, it was critically important. We knew that the rental assistance and utility assistance and in general income insecurity was an area that we had to focus. We received some substantial funds from the state, and we put $800,000 back into our immediate community that we know made a big difference. And the American Relief Plan, of course, is going to also lift temporarily our families out of poverty, and we have to push that those become more long-term permanent solutions. In the area of health equity, I'd like to add that we took advantage of this opportunity to really bring on and employ 21 contract tracers, health navigators, and put our foot soldiers into the community to remind them of the importance of not just COVID, but of health. And I wanted to shout out Gustavo. I see you, our contract tracer from Instituto, for joining us. Thank you. Your work was so critically important because our zip codes in Chicago and here where Instituto is was one of the highest hit in Chicago. So our efforts in ensuring that the equitable distribution of the vaccine are now more important than ever. And we do that with Illinois Unidos, and we do that in a way that is accessible. We want to be able to put those shots, of which I had my second today, in the arms of our workers, not just because they're essential, right? Because they're human, because our opportunity to ensure that our community lives through this is now. So the urgency is greater than ever. Thank you.
Thank you, Karina. That's really impressive, the work that you're doing. And, so excited to be partnering with you. The digital literacy is definitely a very important topic. In fact, we have a participant in today's summit who was asking about work opportunities and expressing some frustration about trying to find a job after having been let go at the beginning of the pandemic. And I think that's the real challenge that our organizations are going to have to address, is how do we help folks get back into the workforce, given the fact that the landscape has changed and the jobs that are being offered now are not necessarily the jobs that have disappeared. So we really have to do work to help make sure that that skilling is taking place and that folks are prepared for the new workforce opportunities that are being made available, because the economy is getting better, but there still are huge challenges ahead. So, Brian, I wanted to turn back to you for a bit, because the Youth Development Institute's been doing an awful lot of work on the child tax credit and the earned income tax credit and in Puerto Rico. And of course, the American Relief Plan has extended those benefits to Puerto Rico in a way that hasn't happened before. So I guess the first question is, how important is this extension to the constituents that you serve? But more importantly, how are we going to make that permanent extension? Because as I understand it, once the funding for the American Rescue Plan runs out, then we're kind of going back to status quo prior to the plan being put in place. So can you help elaborate that for us?
Definitely. And I think, I cannot state how big this is for families in Puerto Rico. Just to give you a little bit of context and why we fought so hard for the child tax credit extension for Puerto Rico. Puerto Rican families who had 3 or more children were the only ones who had access to this credit because of a loophole in the law. And just to give you a number, families with 3 or more children in Puerto Rico are just 11% of all families with children in Puerto Rico. So only 11% of those families were getting access to the child tax credit. Just bear in mind that if you come to Puerto Rico, almost 6 out of 10 children that you would see are living in poverty. So just to give you the context of how huge this is for all the families who are working families in Puerto Rico, who really want to just get ahead. And these credits are going to allow them to, they reward work, and they also are going to make work pay. The more you work, the more you will be benefited by these tax credits. So this is huge for us in Puerto Rico. And we included in our advocacy plan even before the pandemic. We've been working very hard on this since the early 2000s, because we understand that these credits provide money for families to do, what's best for them. So these are money that people are going to use to either, pay rent, to pay for their nutrition needs, pay for their education needs, and really kind of put them on a better footing so they can start building up their economic mobility. So the reason why we also think that this is so great is because, for example, the EITC, Puerto Rico will be getting $3 for every dollar that we invest on our local earned income tax credit. So this is huge. We can design it in a way that it can include more families. It can be expanded. The amount of the credit provided to families can be bigger. And we can also start providing them with the EITC at lower thresholds, which can include and expand for all the families. So we estimate roughly that over 400,000 children will benefit immediately from these credits, and definitely from the expansion, everyone will be able to have access to them. The problem is that they are not permanent. So we need to fight for them so that they could be permanent for all families in Puerto Rico. And for all of you who are advocates out there and really want to start thinking about how can we organize around this, we see at least 2 opportunities to do so. Soon, there will be discussions around the budget. So the budget season opens, and we need to start putting together advocacy days on the Hill and lobbying sessions with our champions in Congress so we can guarantee that Puerto Rico gets permanent access to these funds. Also, this is probably just one of the many bills that the Biden administration are trying to push through. So the next infrastructure bill could be another vehicle for us to really start thinking about how can we construct a more permanent issuance of these benefits to families in need. So really what we're all asking is to provide the needed help for families to not only continue to do the work that they do, but also have a fighting chance at economic mobility and at the American dream that we all deserve.
Thank you, Brian. That's really impressive work that you're doing. Thank you for championing these causes in Puerto Rico. And I know that many of the leaders that are part of the summit today would be very interested in helping you to try to make sure that we can extend those credits for the people of Puerto Rico. Certainly with a poverty rate like that, it's absolutely necessary and the people deserve it. So we look forward to working to try to make that a reality for you. Karina, I'm going to turn to you next. So the Instituto del Progreso has been providing youth development, adult education, career pathways, and immigrant legal aid, in addition to all the COVID relief services that you mentioned earlier, to the Latino community in the Chicago area. How important is it to you, the inclusion of immigrant and mixed status families in these relief bills for the work that you're doing? And has their exclusion from some of the government programs impacted your ability to help these families be able to become resilient and become whole after COVID-19?
Thank you, Brent. That is the real question, right? Let's be honest. For the last 4 years, our immigrant community has been in a quite difficult situation with the rhetoric that's been really causing a lot of fear and confusion within our community. So first and foremost, we are relieved that the inclusion of mixed family statuses are part of this Recovery Act. But it's also so critically important to recognize that we were already behind, right? That these are temporary relief measures that will lift our families temporarily out of poverty for those that take advantage. So there's a critical educational component to what we need to push out, right? We're in the right direction. The ability to communicate this to our communities and stay safe, let's be honest, there's a trust issue, and trusted community anchors like Instituto, like those that are around the table, need to be even more so vigilant to ensure that they don't miss an opportunity. There's skepticism, right? It's too good to believe, but at the same time, there is, it's too little, right? And sometimes too late. We've had so much despair, so much loss, that it's going to take a little bit more than this small assistance to help our families. I think the opportunity here is that the window of the Recovery Act will allow some true engagement, with our community in clarifying the reality and in delivering information that is so critically important. And to be able to wrap around all of the services that a family needs to survive. An individual reports to work not just as an employee, but as a human being. We have to remove the obstacles of transportation and childcare. We have to double down on the equity lens that impacts, in particular, Latina workers. And we have to move towards a immigration reform that is inclusive, a solution to ensure that the pathway to citizenship is real. Right? We at Instituto are proud to be the largest submitter of citizenship applications in the state, but we still got to do much more for our mixed status family incomes. Step in the right direction, need to make it more permanent. Let's double down our efforts.
Absolutely. There's a lot of work to do still to help these families. And thank you, Karina, that's amazing. I didn't know that you were the largest entity providing citizenship services. So that's pretty incredible in Chicago. So Ramon, I just wanted to turn to you. The Committee for Hispanic Children and Families has been focusing on advocacy and programs in early care, education, and development in the New York area. How has the closure and gradual reopening of schools in New York City impacted your work and the students you serve? And what do you feel is needed to help Latino students in the city catch up after being out of school for almost the entire past year? So many of them are struggling to kind of catch up to where they should be. And we know that this is going to be a big challenge going forward.
Brent, thank you for the question. And before I continue, Karina, you juggled my brain a little bit. And I also want to thank the Hispanic Federation. With your support and with our efforts, we were able to feed 4,000 individuals during the holiday season, something that would not have been possible without the Hispanic Federation's work. One of the biggest issues, and we have all talked about the same thing, which is really about education in different formats, but education is at the core of everything that we need to do to really enhance and improve the quality of service delivery for our community. With this roller coaster ride of opening and closing of schools, opening and closing and quarantining of cities, our community have felt the mental health of our community has been really put at risk. And what we have done at CHCF is we have attempted to continue to provide them with as much quality information as possible. They say that knowledge is power. So when we talked about hybrid models, opening and closing of schools, what does that mean? What are your rights? What can you do for your child? How could you make an informed decision? So we had a plethora of meetings with parents and with the administration of the different schools to be able to engage them in what was the best in the interest of their child. The second thing is, once the vaccine and the COVID testing started, where do I go? Right? So we had to pivot to tell people, this is where you go to get tested. These are the places that are available in your community. And doing workshops around them, what does that mean and what does a false positive is attributed to? But the work that we do as far as youth development and after-school programming, we had to do it virtually. But a lot of those science experiments, how do we do them if you're at home and I am in my house? So we had to learn to ship STEM kits and other important information to the child's home so that we could virtually take you through the process of creating a rocket, of creating toothpaste, of learning about technology. So that was a shift. The child development accreditation that we do for our providers, we had to do them virtually. How can we do that? How can we be responsible and at the same time be responsive? So those are some of the things that we had to do. When it came to the vaccine and the time, and Karina mentioned, to tell our communities how important the vaccine is. With a charged political landscape, a lot of people either believe that you're saying it because you're a Democrat or you're not saying it because you're a Republican. To that end, we put together a panel of doctors, an international panel, because we wanted to say to our community, this is not politics, this is science. Don't hear it from the Department of Health only. Don't hear it from the CDC. We had doctors from Argentina and other places that are saying, listen, this is worldwide. These vaccines are safe. The vaccines are important, and these vaccines are needed.